Good morning, everybody, and welcome to the Straumann Arena of Confidence. My name is Francesca, and I'll be hosting the next session on clear aligner therapy of today with Dr. Sam Daher from Canada. Welcome, Dr. Sam Daher.
Thank you. Good morning, all. Thank you for having me. I appreciate it.
Thank you for being with us. So before we dive into the topic, why don't you introduce yourself to us?
I live in Canada. I live in Vancouver precisely. I grew up in Montreal, and I went to school. I did my dentistry at McGill University, and I did my specialty at Université de Montréal. That's where I did my orthodontics. I've been practicing in that city for about 15 years now, and two of my practices are primarily aligners. In other words, I haven't used brackets or braces in those offices for the last 8 years.
Oh, wow.
So it's been purely aligner treatment. So I treat every and all kind of malocclusion with aligners. So I've learned what to do, and I've learned what not to do as well. And I'm proud. I've treated close to 6,000 cases all in all with aligners.
Impressive.
So today I'm hoping to share my experience with everybody.
And we're definitely looking forward to that.
Thank you.
So can you tell us a little bit about when you started using aligners and an orthodontic appliance?
So I was one of the early adopters of aligner treatment. I got certified in 2001. So back then, so it's been 18 years now since I've been using aligners. And early on, it was a little bit limited. Obviously, it was for minor tooth movement, minor crowding, and what have you. But over the years, it evolved into, like I said, in the last 8 years or so, treating every single malocclusion with aligners. So it's been about 18 years since I first started using aligners.
Fantastic. And also, could you walk us through a little bit about the pros and cons of aligner therapy?
Okay, so as aligner treatment evolved, so did our understanding of the product. So it's a twofold. The first fold is the aligner itself has improved. In other words, the software have improved, the plastic itself has improved, and we as doctors started treating different types of malocclusion and trying different kind of treatment, and that gave feedback to all these companies out there.
Absolutely.
And that ultimately helped improve the product. So when it was first started, it was minor crowding, maybe relapse cases. There was nothing major like class 2 treatment or cross-bite correction, none of that. So it was primitive, so to speak. But the second part to that is we as well started understanding the product and the system a little bit more, and that helped us venture and push the envelope and push the limits a little bit more, and ultimately that's what helped the treatment modality grow with time. So part of it was the product itself, learning from our mistakes, but also the doctors learning new things, giving feedback to the companies, and ultimately that helped to that exponential increase in aligner use nowadays.
And growing together, right?
Yes.
Absolutely. And how versatile are aligners in treating malocclusions?
You know, how versatile it is. This is a question that we always get. The limitation really is only the imagination of the clinician. It truly is. How far can you go with aligners? Depends on the knowledge of the doctor, the experience of the doctor as well. I had just mentioned that I do every malocclusion. I treat every malocclusion with aligners. That means extraction cases, surgical cases, impacted canines. So any and all type of malocclusion, I'm ready and willing and have treated them all with aligners. So the limitation really, the limiting factor, it's just like a golf club if you play golf. How good is a golf club? How good is a player? And this also applies in here. So the doctors have to use the product, they have to get used to it, they have to understand it, and then they can make it their own. It becomes an extension of their fingers. And once it becomes an extension of their fingers, then they can decide what is the limitation. So I don't think a company should decide what the limitation of aligners are. I think the doctors themselves should decide what that is, and that obviously varies from one doctor to the next. So if you ask me, I say aligners have absolutely no limitation. Whatever I can do with braces, I can do with aligners, just because I made a lot of mistakes and I learned a lot of things.
Absolutely. Thanks for that. And could you also explain to us a little bit about the role that aligners play in the comprehensive dental treatment?
Okay, so aligners started growing really with the baby boomers in sort of the year 2000 and the 1990. A lot of baby boomers that had sort of either had no orthodontic treatment or had orthodontic treatment and had relapse. In other words, teeth go back and move. So those guys, they had more money than their parents and the previous generation. They wanted their teeth fixed, but they didn't want to wear braces because they've gone through it. And this generation in their 40s and 50s, they certainly did not want braces. So they want to have beautiful teeth, beautiful smile, but they also want to use aesthetic means.
Absolutely.
So they sort of pushed the market indirectly, and so we started using aligners to please these doctors, but then our pride kicks in, and we want to do all we can with these aligners and limit the amount and the effort that we use with regular brackets and braces. So that's how this came about, and I think they work beautifully well.
Fantastic. And you mentioned to me before you have some cases that
Yes.
you would like to show us.
So the idea is what I want to do, and this is Vancouver. Those of you that have never visited Vancouver, it's
nice.
a beautiful city. This is just a quick little picture that I took. But let me share some cases with you. So this is courtesy of Dr. James Paw. And a patient comes in, and these are your what we call a bread and butter patients. These are your everyday Monday morning cases. Patient comes in, she's got what we call lower anterior crowding, but she has an increased vertical dimension. In other words, she's hyperdivergent. She has a little bit of crowding, and she wants to straighten her teeth. So we treated her with ClearCorrect, as a matter of fact. And you notice how she has crowns on the back teeth.
Right.
So patients like that, even if we wanted to do braces, it will be hard to sort of glue the brackets on. We either need to use bands, or if we use brackets, we have to use a special etchant and a special sealant. But with aligners, we certainly can treat her. And you can see these teeth have had root canal treatment, so endodontic treatment. And these teeth we can still move with aligners, just like we do with braces. And when you look at the Ceph, when you look at the lateral X-ray, you can see how she's hyperdivergent. In other words, her mandibular plane angle is a little bit large. So.
Right.
Just to give you the significance of that, when we put braces on patients that are hyperdivergent, one of the first things that we do is we tend to open up the bite a little bit more. So a relatively easy case, or what appears to be an easy case, becomes a difficult case, because braces, what they do is they extrude the teeth, and then that long face right here becomes a little bit longer at that point. So we have to be careful. Whereas with aligners, because aligners cover the occlusal surface, we're preventing the teeth from extruding. So what we're doing is we're controlling the vertical dimension very well. And this is one of the main benefits of aligner treatment for open bite cases or open bite tendency cases. So as we follow through with the treatment, there's a patient at aligner 9. At this point, we haven't placed any attachments. So she's by aligner 9, she's going through a treatment, and then 2 attachments were placed at aligner 15. And you can see them on the upper canine here a little bit. So we placed 2 attachments only, just so it can help us rotate these teeth. This is what we call engagers. And as we progress by aligner 18, look at how well those teeth are moving. If you look at the eye teeth, they're just rotating beautifully well at this point. By aligner 22, the teeth are sitting well, the teeth are well aligned. Remember, what we need to keep in mind is straightening teeth is an easy process. Making the teeth fit together when the teeth are straight, now that's the challenge, right? So the occlusion, we cannot neglect the occlusion. We want to make the teeth look good, but we can't do it separately. The upper and the lower arch have to articulate, and that's where the challenge is. So by aligner 27, not only are the teeth straight, look at those lower teeth, and I'll put them side by side in a second, but look at how nice those teeth are articulating, how nice that bite is. Right? And so there's always this misconception that sometimes aligners cannot fix the bite, which is not true. If done properly, if we understand how aligners work, if we understand the biomechanics of it, aligners do a beautiful job. In my opinion, a better job than braces sometimes, as a matter of fact. So if you look at the end result, and let's compare to what we started with, the top part is what we started with. Look at those lower front teeth, and look at the end. But also look at the bite on the back teeth, and look at the overbite on the front teeth. all of that comes together quite nicely. So
Very
it is a
nicely.
bit of a challenge to put them together. And if you look at the upper and the lower teeth from the occlusal view, again, look at the upper teeth, look at the lower teeth. The teeth are nice, the teeth are straight, but more importantly, they fit well together and they articulate well together. And when you look at the panoramic radiograph at the end of the treatment, those healthy teeth are healthy.
As well.
The roots, there's absolutely no damage to the roots. And the patient is still hyperdivergent, but if you look at the cephalometric tracing, pre-treatment and post-treatment, when we look at the mandibular plane angle, it's still the same. As a matter of fact, it may decrease a little bit. So we're not making that lower facial height, we're not making it bigger, because that becomes anesthetic. And because aligners cover the occlusal surfaces, we do an amazing job controlling the vertical dimension with aligners. So a case like that, even if the patient says, hey doc, you can either use braces or aligners, what I would rather use are aligners, as a matter of fact, because I can control the vertical dimension and prevent a problem in the future.
Absolutely, very interesting. Thank you for sharing that case with us. And now I'd like to ask you whether aligners facilitate or rather complicate comprehensive restorative dental treatment. I guess we can imagine the answer, but...
Yeah, well, let me tell you, aligners, basically, orthodontic treatment, maybe for a while it was almost seen as a separate entity. It shouldn't. Orthodontics is one of the 9 specialties in dentistry. So it should work hand in hand. In other words, when the general dentist refers a patient to the orthodontist for treatment, the general dentist is being the quarterback. The patient should come back, and the orthodontist should have a better idea from the beginning as to what the dentist plans on doing, right? And this has not changed, and that will never change. So when you have the dentist actually treating the patient with aligners, that makes it a little bit easier if you think about it, because now you're dealing with one team, you're dealing with one treatment plan, and that quarterback is actually the coach. You know, maybe I should use soccer analogy instead of American football, but the coach, the defense, the offense, and they bring it all together. So in my opinion, it makes it a lot easier. Let me give you an example. A patient that has front teeth, upper anterior teeth that are overlapped.
Right.
Now you need to straighten them, and the orthodontics part does that well. So the dentist goes in, they start using Clear Correct, they straighten the teeth, and now you realize there's a defect in the shape of the tooth. It may not be a cavity, it may be that just the shape of the tooth is not ideal.
Yep.
This is where the dentist can come in, either do restorative work, veneers, crowns, whatever the case may be, lumineers, and then they can actually bring it all together. So having that foresight, being able to pre-plan it is actually going to be a big asset. And because of technology, because of the digital world that we live in, which hopefully we'll discuss tomorrow, because of that digital world, it's a lot easier. The flow is a lot easier, right? The planning is a lot easier. And ultimately, we talk about the doctor benefiting from this. The ultimate winner is the patient.
Absolutely.
Right? Because we're saving on time at this point. We're putting the plan together, and we're communicating with the patient, and we're explaining. So does it make it better, easier, or harder? It certainly makes it a lot easier.
Great. Thanks for that.
Thank you.
And what advice would you have to share for a general dentist considering to start with aligner treatment therapy in their practice?
Okay, just like with anything else, general dentists obviously need to have the basic knowledge and understanding of not only how orthodontics works, but how aligner treatment works. It's not anything, there are no major challenges to that. It's just a question of knowledge. Just like we do with implants, just like we deal with root canals, you need to have the basic knowledge to understand.
Absolutely.
Now, moving teeth, and we're not moving one tooth, sometimes we're moving every single tooth, so we're talking about moving 28 teeth, or we're moving 6 or 12 teeth, whatever the case may be. So the first thing will be take a course, get acquainted, get to know it. But you don't have to be an orthodontist per se to start treating cases.
Okay.
What you need to do is, number one, recognize the problem, and number two, recognize the challenge and recognize your limitation. So an educated dentist will always serve his or her patient better.
Absolutely.
So when the dentist recognizes a problem, they may say, I recognize the problem, it's not for me to treat, I'm going to refer to an orthodontist, right? So the patient benefits on that. So Can dentists do it? Absolutely. They just need to know the basic knowledge. They need to ask questions. They need to take courses. They need to have interaction with their colleagues, because ultimately, aligner treatment or orthodontic treatment, be it minor or major, whatever the case may be, is going to be part of the full treatment plan. So my advice to them is, if you've not done a course, if you haven't familiarized yourself with orthodontics or aligner treatment, go ahead and start. Pick a course, pick someone that you trust. I know ClearCorrect are starting with their own continuing education programs, and this will be a good way to start, because ultimately, we don't teach aligner treatment, we teach orthodontics with aligners, right? So you need to have a nice balance, but it's not dentists are dentists. And this is dentistry at the end of the day. It's a branch of dentistry. So they certainly need to take a course, get familiar, and get their fingers wet. You need to try it, because no matter how much you see on a screen in front of you, unless you do it yourself,
you need to
you're
put
not
your
going to
hands
learn
on.
it. That's exactly it.
And will the technology further improve with time? What's your guess on that? What do you see there?
Just like everything else. So, in medicine, technology nowadays is just, we're going through a medical revolution. And dentistry is only one part of medicine. And that's what's happening now. And this is what's happening in the world of dentistry in general. Look at implants. Look at all the products. Look at digital radiology. Look at intraoral scanning. Aligners. Aligners are nothing but a marriage between plastic and a computer software.
Yep.
So that marriage actually leads to what we see today, that treatment that we see. So software is constantly improving. 3D printing is constantly improving. The plastic and the material is constantly improving. And we, as clinicians, are constantly improving by learning, by sharing our experience. And here, what I learned, I will share with my colleagues, and what they learned, they share with me. So a combination of all these factors put together is only going to make the aligners improve. Any aligner, it's only going to improve, it's only going to get better, and it's only going to make our life a lot easier, both as patients and as doctors.
Fantastic. And now, as maybe the final question to you, I'd like to ask you if you could step into the future for a second and look at aligner therapy. What would it look like in the future? What do you see there?
Yeah, well, what does the future hold? I think, and I said this about 10 years ago, I think at some point major treatment in orthodontics will be done with aligners and not with braces. I would give it 20 years. Personally, I think in 20 years, braces will be as rare as headgears, right? I think aligners are going to be the treatment of choice. And we're going to stop comparing aligners to braces, because aligners are going to be the standard of care. And I see it because I've seen how much aligners have evolved in the last 18, 19 years. And now that they're going to continue to evolve exponentially, because that base, everything that we learn, we're going to put it to good application, and everything on so many fronts and so many levels are going to improve that the next 20 years, we're going to learn almost 4 or 5 times more than when we learned. So I think it's going to be the standard of care, no doubt about it. In my opinion, if you're not treating with aligners just yet, you're falling behind the 8 ball. In other words, you're going to be falling behind. So can I show just one last case before we go? And this second case, again, it's somewhat similar, but this is the earlier patient I showed you was an adult. Now, this is a younger patient. This is a patient in adult dentition, but sort of in her late teens. So you can see how she has a little bit of a crowding, a little bit. You can see her tongue through her canine on the right-hand side, which what we call an open bite. So she's also hyperdivergent, but she's class 3. Basically, her lower jaw is slightly forward. So as you straighten the teeth, we want to be careful not to bring the front teeth edge to edge. So we want to factor that in. And again, this patient was treated with ClearCorrect by Dr. James Ma, and he was nice enough to share the records with us. And again, when you look at this, she's hypodivergent. In other words, I want to make sure that even if she asks for braces, I do not want to treat her with braces, because I don't want to make the vertical dimension any worse. So we'll look at it, we treat her. There she is at aligner 5, and you notice how not only are we straightening the teeth, we're trying to improve the front, the anterior overbite, and overjet. Aesthetics are important for this young lady, and I don't blame her for wanting aesthetic results at the same time. We're moving to aligner 10, and look at that. The bite is starting to come well together. And the trick here is to work on the lower arch, because she's done growing, So we have to work on the dental level, not on the skeletal level. And what we're trying to do is retract the lower front teeth so that the upper teeth can come down and forward. So the trick really here is to focus on the lower front teeth mostly, and all we have to do on top is straighten the teeth on top. So that will help with both aesthetics and function. By aligner 15, and there's an interesting part where those teeth have not extruded all the way. So if you look in here, you'll see that we bonded buttons. Right here you can see them. And we added attachments to the aligners, not to the teeth. And at this point, what we did is we asked the patient to wear the same aligners, but wear elastics. So what that did is it extruded the teeth, and the teeth can come together. And by the end of aligner 15, and if you look at the photos, now she's done wearing the elastics for 3-4 weeks. Look at this. Look at how nice that bite socks in. So we need to have auxiliaries. We need to think outside the box. The aligner is not treating the patient. The doctor is treating the patient. And an aligner is just one tool. Elastics are other tools. Mini screws, mini implants one day will come and play a big role with these aligners as well. That's going to be another tool. So we have a lot of tools to use, to choose from, but that's why understanding biology and understanding orthodontics is going to be important, and it's going to make the doctor a better clinician at the end of the day. So if you look at the before and after, notice how these teeth have extruded. So the aesthetics look nice, but as a doctor, I'm more concerned with the function. And that's a beautiful class 1 relationship at the end of the treatment. And if you look at the upper and on the lowers, again, you can see, just looking at the occlusal, how beautiful and aesthetic it is. But remember, uppers alone, lowers alone, that's not enough. It's the way they interdigitate, the way they fit is what gives us the occlusion. So at the end of the day, I think this is the future. This is going to be the standard of care. There's no doubt in my mind. And it's upon all of us to learn, to improve, and to share our knowledge and experience. That's the only way for us to improve.
Fantastic. So on that note, I'd like to thank you for sharing the knowledge, the cases, and all your experience with the aligners with us today. And I am looking forward to seeing you tomorrow.
That's true.
As well, talking about the digital ecosystem. And on that note, I'd like to also thank the audience at home for watching us. And that's it from the Straumann Arena of Confidence. And stay tuned this afternoon for the next sessions.